This is Jessie Taylor, and my article is Highly Challenging Balance Program Reduces Fall Rate in Parkinson Disease. First of all, I wanted to give a brief overview of Parkinson disease. It's a degenerative disorder in which the brain stops producing enough dopamine, and that results in the inability to coordinate movement and control body systems and emotions. The motor symptoms are the most obvious, but they only appear when 60 to 80% of the neurons that produce dopamine are damaged. The non-motor symptoms, such as the loss of the sense of smell, may occur years earlier, and scientists are trying to find a way to diagnose Parkinson's disease based on those non-motor symptoms sooner so that they can possibly halt or slow the progression. Parkinson's disease itself is not fatal, but it has serious complications that are, and there is currently no cure. There's also no specific progression that is applicable to all patients with Parkinson's disease, but typical patterns do exist. It usually progresses from stage 1, where a patient has mild symptoms and no impairment of ADLs, to stage 5, where the patient is wheelchair-bound or bedridden and requires 24-hour nursing care. Age is the most common risk factor, with most people who are diagnosed being over the age of 50, although 10 to 15% have a genetic link. And having a first-degree relative, which is a parent or a sibling, doubles your odds of getting Parkinson's disease versus the regular population. There's also a chemical exposure link to chemicals used for welding, farming, military, and industrial applications. Men are more likely to be diagnosed, and there's an estimated 10 million people currently in the world with Parkinson's disease. Authors of the study decided that they needed to study a balance program and its effects on falls because impaired balance is a hallmark of Parkinson's disease, with over 50% of patients with Parkinson reporting recurrent falls. And 68% of people with Parkinson fall at least once a year, which is twice the national average for healthy older adults. And that's something that we're likely to see in our practice as PTAs. Interventions are needed to reduce the effects of the falls, to reduce disability, improve the quality of life, and possibly increase survival rates of patients with Parkinson's disease. Most patients with Parkinson's disease are on medications, but those medications usually address the symptoms of the disorder and not the balance issues that cause the falls. The authors identified previous studies that indicated highly challenging programs were likely to have the best outcomes, but few of those studies actually looked at the effect of the programs on the risk of falls. This is a graphic taken from the article, and you can see that it was a randomized crossover trial. The study participants were broken up into two groups. The first group had an active period where they had 3 months of high-intensity balance exercises, followed by an inactive period where they just received their regular care for Parkinson. The second group started with a 3-month inactive period where they received their regular care, and that was then followed by a 3-month active period. And the participants were given an initial assessment and then reassessed at 3 and 6 months. The people who participated in the study were 23 subjects who were recruited from Boston University Parkinson's Disease and Movement Disorder Center. 16 of those patients completed the study. 63% were male, and the mean age was 66.7 years. All of them had a diagnosis of idiopathic Parkinson's disease and were currently at stage 2 or 3 of the disease. They needed to be able to walk independently without an assistive device, and they also were required to have had a fall in the previous 3 months or 2 falls in the previous year. The authors also wanted patients who were able to walk at least 5 continuous minutes, had been on a stable dose of medication for at least 2 weeks prior to beginning the study, and they excluded anyone with a diagnosis of atypical Parkinson's disease, a mini mental score below 26, anyone who'd had surgical treatment for Parkinson's disease, and all patients with serious comorbidities. All of the participants were also asked to sign an informed consent as to the study purposes. The actual intervention that was done was a highly challenging group exercise program that was held twice weekly for 90 minutes over a 3-month duration. To ensure equal challenge for all the participants, no home practice on any of the activities they participated in was to be performed at home. When the challenge was reduced to a 7 out of 10 on a 10-point Likert scale, the The authors used weighted vests or variable surfaces to increase the challenge for all of the patients. The measurements that were performed were interviews during the active interventions that were mostly regarding the falls since their previous sessions, a mini balance evaluation systems test that was administered by an impartial PT who was not involved in the intervention, and a Falls Efficacy Scale International, which is a 16-question survey to assess the participants' own fear of falling. These tests were administered at the end of the active and inactive periods, and the authors determined that the treatment effect would be the difference between the scores. The results of the study overall were improvement. The FESI, mean score, improved 3.2, and that was the test that the patients reported their own fear of falling. There were also improvement in the mini best score, which was the one reported by the impartial physical therapist. And the authors also estimated a 37% reduction in a fall rate per month per patient, which is pretty dramatic if you think about it. There were some limitations of the study that the authors identified, the first one being a very small sample size. They also noticed that there was limited carryover, and that meant that the results of the balance program dissipated over time, so patients needed to continue with an exercise program to keep the gains that they made during the study. And that's something that we can remember in our practice, not just with Parkinson's disease patients, but with all of our patients. We do need to remind them how important it is to take some of the activities that we do and practice them at home so that they can keep themselves in the best shape possible. Another limitation that the authors identified was that it was not necessarily generalizable to all Parkinson's disease patients. They limited the scope to patients with stage 2 or 3 of the disease, and there are 3 other stages of the disease that might not have the same results with a balance program such as this one. They also relied on patients' accurate reporting of their falls, and everyone knows that patients can misremember things, so that is something that they addressed as a limitation. And this is my reference page showing the information regarding my article. I've also emailed it to everyone if they want to read it over, and I want to thank everyone for listening. Have a good day.